Hello. Yes, I'm Lauren Waterman. I'm one of the pediatric endocrinologists out of the Barbara Davis Center in Colorado, and I'm really excited to be here with you guys today to share with you guys something that is near and dear to my heart, which is the development of our transition curriculum from our patient identified topics. So I don't have anything to disclose today. I don't think I have to convince anybody here that emerging adults with type 1 diabetes struggle with glycemic control and transition readiness. We've already heard that from plenty of people today. But just as a little bit, this is a time of growing independence for these young adults. And unfortunately, diabetes self-care can often kind of fall down the priority list, especially as they start encountering new and exciting exposures and living separate from their support systems. So in addition to the basic self-care, they do require anticipatory guidance on a number of topics that can greatly impact their health and safety, particularly around alcohol and substance use, particularly around cannabis, as that is increasingly legalized across the United States, but also looking at the impact of sex on glycemic control and then contraception and pregnancy for people who can become pregnant. And then unfortunately, kind of in the current climate, there is an increasing need on talking about insurance and healthcare navigation, especially when people are not able to financially afford their supplies. And then independent living and meal planning, particularly those who are on governmental programs. But since this is also a population where it can sometimes just be hard to get them to announce their meals, comprehensive transition education can be difficult to achieve in routine clinical visits due to time limits. And while I know I could talk to young adults about these things for a long period of time, we do have over 1,000 patients that we see every year who are 18 years or older. And so this is something that we need to develop kind of on a more clinic-wide. And so in order to develop our transition curriculum, I first wanted to determine the discussion rates of patient-identified transition topics in our pediatric clinic through EHR note template notifications. And so this was kind of a two-pronged project. One was going to be looking at what the patients are identifying as things that they want to learn more about, and then what are the providers actually talking about with kind of minimal educational interventions from me. And so first, we wanted to look at the patient-identified topics, and we use this through our learning about your new experiences assessments or our links, kind of based off of our Panther program. And this was adapted from the READY 1.0, so the Readiness of Emerging Adults with Diabetes Diagnosed in Youth survey. And for those of you who maybe aren't as aware of it, it ranks patient confidence in a number of transition topics on their ability to navigate this independently, ranked on a scale of 1 of haven't thought about it to 5, yes, I can do this. And it looked at topics related to diabetes knowledge, health system navigation, insulin self-management, and health behaviors. Now, we had attempted to use the READY previous to me taking over as the transition head. But unfortunately, this was limited by, one, it was long. It was 44 items, so a lot of our patients weren't completing it all the way. Or you get a number of people who just say, yes, I can do this to all of this, and it doesn't actually work as a readiness tool. And so in order to try to improve this, we actually divided READY into 2 parts because we weren't using the actual score. This was more of a conversation starter. And part 1 was more of the basics of diabetes care. So do you know what your hemoglobin A1C is? Do you know how to determine your insulin doses? And part 2 are more of the kind of the higher level things like sex, substance use, healthcare navigation. And then each part has, the goal is to administer on a yearly basis from the age of 16 until they transition to adult care, which is generally around 22, 23 for our center. And since we started implementing Welcome, people actually can take this at check-in, so we don't have to worry about assigning it ahead of time or people just not taking the survey. But we also wanted to make sure that people actually, like the providers actually saw what the patients had indicated, since often it goes to the questionnaire folder and people may not have time to look at it for their clinics. So unfortunately, it might be a little bit hard to see this, but each question is assigned a keyword or phrase. So for this first one, it is describe 3 long-term problems that might come from a high hemoglobin A1C, gets turned into complications. Tell someone about the effect of alcohol on blood glucoses, gets turned into alcohol. We've got tobacco, and we have sex and pregnancy. And then topics that are not rated as, yes, I can do this, get included into the note template as a conversation prompt for providers. And so it gets put into the note in kind of prose form. So when the patient takes the links assessment, anything that's not written as a 5 gets popped up here. And then we were able to pull the patient responses from the last 12 months from the EHR. And the prompt gets put into the HPI, so it's very early for the providers to see. And then we also wanted to see kind of what topics providers were actually discussing. So we also included a drop-down list in the note template that prompted providers to document what they talked about during that visit. And it was a hard stop, so they must interact with it before they can close their note. And so even if they didn't maybe necessarily talk as much about it the first time, the goal would be with a number of repetitions, you would actually start to think about making sure that you talk about these topics early in your visit. And then we also pulled the discussed topics from the last 12 months from the EHR. And we've actually had some pretty good success about completion. So in terms of part one, we had about 1,100 patients with 72% at least identifying at least one topic of concern. And then part two, just because we also had to work around our DEPSAR and some of our other screenings, we had about 400 patients with about 83% identifying at least one topic of concern. And so taking a look at the graph, we have the percent of visits that the topic was either requested by the patient, which is in brown, or the discussed by the provider, which was in black. And the patients requested help across like most transition topics, particularly around insurance, sex and pregnancy, and tobacco. I don't know if I can. Oh, yeah. Sex, alcohol, tobacco, but also diabetes goals, because these are mostly related to the hemoglobin A1C, which despite multiple discussions, it's still sometimes hard for people to keep that in their brain. But as you can see from the black, the provider discussions focused mostly on routine diabetes management with a little bit of diabetes goals. And the largest gaps kind of seen between substance use, sex, and insurance. And so despite the EHR prompts, providers still infrequently covered key components of emerging adult care. And likely this is due to, again, the need to cover many topics within a limited appointment time, but also a lack of familiarity with these topics by pediatric providers. But as I found in one of the other studies that we're doing, a lot of our patients are already engaging with things like alcohol, cannabis, and sexual activity. It is vital that we actually talk about these things early in our pediatric clinics. And so since I know it's one thing for me to say, oh, you need to talk about it, you need to talk about it, there are limited time periods. And so since we have a wonderful healthcare team, we thought it best to actually be able to utilize that. So we have been developing the Compass curriculum that goes along with our Compass Clinic. Since we're in Colorado, it's lots of hiking and mountaineering. And so we have our north, south, east, west when it comes to our transition topics. And our goal is that a number of different providers could cover each of these areas depending on time periods. And so we have our navigation, which is primarily focused on healthcare navigation that is kind of helped by our social workers and our patient navigators and some web providers. Education, which includes a diabetes refresher, but also substances and sex by the providers and the educators. Social support, especially in terms of accommodations and your rights, are through social workers and some patient navigators, and then wellness, which is a lot of our dietitians and our educators as well. Right now, we're piloting this within our monthly transition clinic, including a new Epic interface so that we can actually document when each of these topics has been covered at least the first time. And then we're planning on widespread adoption into routine clinical care. Thanks.
My name is Candace Williams. I'm representing Cook Children's Medical Center in Fort Worth, Texas. You had mentioned about the hard stop for providers. So I take it you guys are all using standardized notes, so that is required. Okay.
Yes.
For some of these other, so this logo here, is this something that's available on paper for patients as well as in their EMR so that they're referencing it regularly?
Yeah, so right now we have the flyers that have the compass and all of these up in every clinic room because we're also growing the actual transition clinic. And so from a patient perspective, this is mostly this comes from an advertisement of the clinic itself. And then within the amongst the providers, there's a section built out in the rooming tab of Epic that will have kind of all of these topics available too. And then it helps do a running list of topics that have already been covered. So.
I did have one more question that, as you mentioned that, I did run into some difficulty kind of telling a parent, we're trying to start this conversation at 14, and so it was probably not ready, and told them what to expect. They were very resistant, not just to the, drug, sex, and rock and roll conversation, but just that, oh, well, we want to stay till we're 20. And I said, well, we're not going to do that, but, we'll walk you through this process. So how do you deal with, and this could apply for all the centers, families that we're having the conversation, but they're still very resistant to the information.
Yeah, no, it is definitely something that we have been having issues with because we don't have a hard stop in terms of how old people have to be before they transition, especially with Colorado. We do serve about a 7-state region, and so sometimes it is hard for them to even have an endocrinologist close to them if they're living up in Wyoming or Montana. And so we're a little bit more lenient on some of these things. But even just having the Ready questionnaire starting has anecdotally led to a lot more patients bringing it up themselves to the providers. That is actually a big feedback that I've gotten from my fellow providers is, oh yeah, people were actually asking about this. People were curious about this. And so we are starting our firm talks about it and Ready starting at 16, where people are feeling like a little bit more comfortable with the idea that college is coming. And so we haven't run into as much of a resistance about the general transition topic. Definitely there are some patients or some families that maybe don't want to talk as much about the alcohol. That's usually when I kick the family out of the room, or I keep it incredibly broad, like especially with cannabis being legal in Colorado at 21. It's like for alcohol and cannabis, you're totally not doing it right now, but do you know what alcohol will do? And that honestly has actually led to a lot of really good discussions, even with the parents who maybe are like, oh yeah, I hadn't thought about that. So
I just have a question.
Mhm.
CMA Kasha from Cohen Children. So with so many people involved in the care and, in this medical, how do you keep up who has done what and which part has been completed? Is there a way?
Yes, and that's what I've been working with our Epic analyst, which we are lucky enough to have a dedicated Epic person at our center who has helped me build all of these things. But the way that we have it structured within the rooming is we will be able to pull what patients have gotten what part of the curriculum as part of a report. And then having some of our patient navigators and the people who are part of the Compass curriculum, the eventual plan will be for them to kind of be keeping track. And then the same thing, making sure that we're having our educators and everyone else involved too. So if we know that they need to get part of the Compass curriculum, putting in a referral so that there is a note that they get seen at the next appointment.